No matter your age, gender, socioeconomic status, or other factors, parenting is no easy task. Yet we often expect ourselves to be the ideal, stress-free parents who know how to do it all easily and perfectly. Contrary to the images we see on social media and in the fairy tale landscapes of our minds, parenting can be one of life's most challenging journeys. And all too often, just when we think we have things under control, a new life stage or situation crops up to remind us that nothing in life is perfect, especially the ups and downs of parenting. Is it possible that one of the greatest secrets of parenting is the art of relaxing, finding autonomy, and diminishing anxiety? Today, we'll focus on this listener's real life question. I have two preteen girls and another child on the way. My husband was recently diagnosed with a rare form of cancer, and we're hoping for the best. I am so distracted and stressed that I worry I'm not being a good mom to my daughters and won't be able to cope with a newborn. I don't have anyone to confide in. Can you direct me? And with that question as the focus of today's episode, I'm Dr. Carla Manly, and this is Imperfect Love. Welcome to Imperfect Love with Dr. Carla Manly, psychologist, author, and relationship expert. I'm here to help unravel mysteries and misconceptions about love, relationships, and mental health issues, plus everything in between. Love is complicated, people are not perfect, and relationships surely can be tough. Together, we'll navigate this messy, imperfect space of real life. Please note, as this episode contains sensitive information, listener discretion is advised. If you need support, please see the special links in the show notes. Today, I'm joined by a very special guest, Dr. Emily Edlynn, Stanford-trained clinical psychologist, parenting expert, and author, who will be sharing her expertise on helping parents of all ages tune into the joy of parenting by dialing down their stress and anxiety. Dr. Emily, welcome to the podcast. It's such a pleasure to connect with you again.
Thank you so much, Dr. Carla. It's lovely to be here again.
So, before we launch into the topic of the day, could you share with our listeners just a little bit about what makes you you?
Well, I am a mother of three. My kids are 15, 13, and 10. And I am a trained clinical psychologist specializing in children. And I grew up really identifying as a writer. So my whole childhood, adolescence, young adulthood, I loved writing. I was an English major, it was my passion. I also was really pulled to helping children as a career. So I landed on child psychologist as my profession, but a few years ago, I got to figure out how to intersect my love of writing and communicating with my love of children and families by starting to write about parenting.
What a lovely background. And are there any pets in the mix in this
There are
lovely
two
family?
There are two adorable dogs. One is 4, the other one is 1.5. They are both rescue dogs, and they bring so much love and joy to our family.
I love the power of pets to
I
help a
know.
family be even more lovely and more cohesive. They're just amazing.
There's
Yes.
more there's more cleanup, unfortunately.
There
There's always
is
the
more
downside.
cleanup. There is the cleanup, and it's interesting. I learned when I was in my master's program, I'm such a neat freak, and I remember I was pretty young at the time, and this one professor, Dr. Skip, she was talking about the fingerprints on the screen door, the slider, not the screen door, but the slider glass door after the kiddos left, her grandkids, and she was hesitant to wipe them off because they were the reminders
Mhm.
of those beautiful interactions with the little
Yeah.
ones and their stickiness. And I remember thinking at the time, oh, gross. Who
Yeah.
would leave sticky fingerprints on a door? No, 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 things must be clean. Well, I came very quickly to see the importance of things like that and how when we change the mindset to see, oh,
Mhm.
it's not dirt, it's not a mess, it's evidence of love, it's evidence
Yeah.
of movement and joy and beauty. And so when my dog Freedom leaves footprints, I look and I think, ah, it's evidence of my muddy puppy in the house. And he is an eternal puppy with his muddy ways. And so it does help me be less of a perfectionist because I learned to just embrace the
Embrace.
mud and clean it up. I don't leave it, but I do have a new way of looking at it. So I
Right.
agree, it does make the cleaning quite a bit more chronic. You just are a
Yeah.
chronic
Yeah.
cleaner.
It's just always a mess here. Yeah. Okay.
So when we talk about this listener's question, and it just makes my heart so sad for her, I
Mhm.
really feel, because parenting itself is such a big journey, such a big, and no matter what age they are, 5, 10, 20, 30, 50, however, you never lose the job of being a
Right.
parent. And so you have a new book out, Autonomy Supportive Parenting. So could you tell us a little bit about the book so that we can weave some of the principles into helping all the listeners, as well as the person who wrote in, really understand more about how building a stress-free inner world and outer world, being more relaxed, less anxious, and more autonomous, because people
Mhm.
might not understand, like, what does she mean autonomy? Does that mean I get to leave my family and just run off to Baja? Yeah, what does
Right.
that mean? Can I get to hop the plane to Hawaii anytime I want? Well, probably not.
No.
But
Unfortunately, no. Well, and when it comes to kids, what I hear a lot is, "Oh, so they can just do whatever they want?" Absolutely not. That's not actually autonomy. So I'll get into what it is. It's a really big concept. And I'm so curious what people think of when they hear the word. I think a lot of times people associate it with independence. And there's an element of independence to being an autonomous being, but it's so much more than that. So, to be autonomous or have autonomy means feeling a sense of choice in your life, as well as a sense of mastery over your daily living and a sense of who you are, a sense of self. And so, autonomy supportive parenting is nurturing all of that in our children through some strategies that I'll get into. But I want to also recognize the other parts of autonomy supportive parenting that have to go together with autonomy, and that is competence and relatedness. So these three needs are fundamental to being human. And this has been shown in the research, and it's under the umbrella of self determination theory that people who feel autonomous, competent, and related are happier, healthier people. And so when we have an autonomy supportive mindset as a parent and are using that in our homes, the goal is raising children who are autonomous, competent, and related. So I got into autonomy. Competence is having a sense of confidence in your skills and belief in your abilities to be competent in how you go through your daily life. And then relatedness is that sense of belonging and connection in relationship, feeling emotional safety. And that is the linchpin for autonomy and competence to grow from. And so that's where parenting comes in so critically, is because we are our child's first experience with relatedness. And so we're creating that foundation of empathy and helping our child understand our perspective. We need to work on understanding their perspective, but it's really that relationship that then everything else blooms from.
I'm getting an image of a person sitting on a horse saying, whoa, whoa, stop, stop, because the pieces you're talking about, all of which, as someone who really works from an attachment foundation,
Mhm.
that we know. Many adults don't have those
Mhm.
elements in their own lives. Some people feel very competent at work. Some people feel, oh, as you said, their thinking being autonomous means I take care of myself, I'm
Right.
independent, I don't need anyone, right? Which is not what autonomy is.
Mm.
And many, many, many people suffer from a
Yes.
lack of relatedness, not
Yes.
through any of their own. This is not a fault, shame, blame podcast. We don't go there. There's no use
Right.
in that. But we can often look at our childhood experiences, if we
Mhm.
pause to look at that, and realize that intergenerationally often
Mhm.
we were not, our parents didn't learn, their parents didn't learn, did not learn how to truly relate. They learned how to provide food, clothing,
Mm.
shelter, possibly, sometimes, sometimes not, but they often didn't realize the importance of being really strong interpersonal relations, being able to really attune to each
Yeah.
other, see each other, be empathic.
Mhm.
And again, that's, the hallmark of secure attachment. We see it, it is being attuned. So there may be parents of whatever age, right?
Mhm.
Listening and saying, wait a minute,
Mhm.
I know I don't have these skills within myself. I'm insecurely attached, or if they don't even know what insecure attachment is, they might be saying, I just know my personal world is a mess. How can I, if my mental, emotional, physical world is a mess, how can I provide this to a kiddo,
Mhm.
whether they're 5 or 15 or 25, if I don't have it within me?
It's been really powerful to talk to so many parents where they know that the childhood they had, they don't want to replicate for their children. And I think the amazing self awareness of parents these days should be highlighted. We're always talking about the problems and the negatives, but I really see this generation of parents raising kids today as extremely open to doing things differently and really in tune with what they want to be different for their children. And when that's in place and they learn more about how to do that, it is very possible. So I think it's starting with that self awareness, the insight, really naming what felt like a negative experience for you as a child, what you want to be different, being really clear about that, whether it's my parents never listened to me. I want to make sure my child feels listened to. It can be as straightforward as that. And then being open to getting support around that. The other problem is, especially in America, we're very much individualists and think that we have to do all of this on our own. And it just doesn't work that way. We need support and connection and community. So I think it's being vulnerable, reaching out for support in informal ways. Maybe it's just you feel a connection with another parent on the playground and you ask to go get coffee, like making those brave steps informally. Maybe it's finding an online community that fits your values and you become active in that community. There's so many choices these days. So I think it's also knowing you're not supposed to just figure this out all by yourself.
I so appreciate those words because they're so true. And I join with you in being amazed by the level of self growth, self awareness in the world where people are
Mhm.
starting to realize, wait, I have power here. I don't need
Mhm.
to pass this on. I don't want to pass it on. And in fact, sometimes when, I don't know if you found this, but I'll be working with someone and they're having trouble making the shift for themselves, whatever that shift is. And then when you say, well, when you have children, because you might know that they want children, or if you have children,
Mhm.
would you want to pass this on to your children? And the lights go on and
Mm.
they're like, no, no. And that's the impetus often
Mhm.
for, and it's so wonderful to see that desire to
Yes.
do it differently because, again, that's where we leave the shame and blame behind
Yes.
and just simply say, okay, I can't change what happened to me, but I
Right.
can change how I pass it on. I can change those patterns. And we tend to be, as you said, in a highly individualistic society
Mm.
where we think we ought to be able to do it on
Mhm.
our own. And we're also in a quick fix society.
Yes.
So those two things coupled together, it is not a good thing because we think that we ought to be
Mhm.
able to go and take a pill for that or
Right.
buy a product for that. When even, and you and I both write books, and one of the reasons, in
Mhm.
fact, my most recent book, The Joy of Imperfect Love, it's all about being attuned to all of your relationships. It comes from an attachment perspective. And the reason I'm so big into self-help books, as I imagine you are, is they're not a replacement for psychotherapy, but for someone who doesn't have the money or can't access psychotherapy, reading a book or listening to a book can really help you on your way in such powerful,
Mhm.
micro steps, because we all need support. It's not, we don't learn to drive without support. Somebody gets us in the car, gives us a safe place we hope to practice. Everything that we do in life, we must learn, we must be coached on. And again, in our hyper independent society,
Mhm.
we're often thrown into parenting or choose parenting, not realizing, oh, wow, this is no easy. It is not an easy task.
Well, and if you look back anthropologically, parenting was not supposed to be done by just the two people who had the baby. It is a communal act. But in our modern society, how things have shaken out over hundreds, thousands of years is that we're very isolated and feel like it is just us that is supposed to raise these children. And so I think it's realizing there's actually even a mismatch between, I think, how humans were designed to procreate and raise children and the lives we're living today. And so we're fighting against that reality.
Absolutely. And thank you for highlighting that, because it is one of the most problematic aspects of parenting. People don't live in multi-generational homes anymore where grandma's, right down the hallway or next door. You may have no relatives, and it almost sounds as if, taking this to our listeners' question, it sounds as if this individual is really
Mhm,
isolated. She
mhm,
doesn't, I don't know the relationship with the OBGYN or the primary
mhm,
healthcare provider, but it sounds as if maybe in everything that's going on with the husband's medical
mhm,
condition, maybe that's where the focus is. And so she's treading water and feeling very anxious and
mhm.
fearful. I would imagine not only for the state of her marriage and her life as she knows it, but for the two preteen kids
Yeah.
and then the new one that I don't know how soon they're going to arrive. So, what specific thoughts might you have for our listener on this topic?
If this person was sitting across from me, I would ask, what are your expectations for yourself? So, first, I would want to hear what she's thinking she should be doing. What are the shoulds? Because often we don't even realize how those are creating our own suffering. And when we can, and it takes talking to another person. I mean, as a therapist, I help people do it all day, and then I do it myself all the time. And I need someone else to help me get out of my head. But I think it's that idea of shifting expectations, having compassion for the context that she's in herself, and I think, and I'm not trying to say this is on her to fix it because I don't want to give that message. I want to be really understanding of how much stress this creates for a family system. I've worked in oncology in the hospitals. I know the pain and suffering that goes along with any family member going through a cancer diagnosis and treatment. It is a really intense pressure and stress. So I think it's paying attention to what is she expecting of herself? Are there places she can give herself some grace, let some stuff go? Then I would really want to know more about the connections with the two kids, the preteens, and just what those relationships are like to begin with and what are the strengths. I'm always about leveraging the strengths of the relationships. And it's hard to give really specific advice because I know how different kids can be, and it's all about their personality and temperament and needs of what fits best, right? But I think in general, being really focused on their connection and relationship through this hardship is the priority. And some of the other stuff can be lower on the list if those other things are stressing her out, like clean rooms, doing laundry, things like that.
Thank you for breaking it down so beautifully. So, when we look at the idea of expectations, I think that's a really wonderful place to start. And that idea of should. And
Mhm,
I talk about that on the podcast frequently, where should is known as violent communication in certain realms, right? And we don't realize that we are often shoulding ourselves.
mhm,
I should have the kitchen perfectly clean.
mhm,
I should have the kids, perfectly ready for school every morning and get my husband to the doctor appointments and do this
mhm.
and be part of the PTA and go to my job, whatever's happening in this person's world, and all of those should messages, and realizing without judgment when they pop up.
Yes,
Just notice when these should
notice.
statements, exactly,
Mhm.
when do they pop up? And then instead of using should, replace it with, well, it would be nice if
I
the house
could.
I could,
I
I
could.
might want to, or
Right.
anything that feels more empathic and
Mhm,
gentler
mhm,
without this really harsh inner critic that's saying you
mhm.
should or you're
A
imperfect,
bad mom.
a bad mom,
Yeah,
right?
yeah,
And instead of saying it's okay to be imperfect, we're all
yeah,
imperfect, so things are going to be a little messy for a while. Okay.
yeah.
It's okay to have this. It's really interesting because now we're kind of going back to the beginning of the podcast where we were talking about embracing a bit of messiness,
Mhm.
and that it's one of the reasons I believe in imperfectness and embracing imperfectness. It's not an excuse to be a horrible person, it's a reason to allow yourself to be human, to allow ourselves to be a little messy sometimes. And so I think it's a lovely way to help this listener who wrote in and all of our listeners realize
Mhm.
if you're shooting yourself and being really hard, really critical, it's okay to relax a little bit. It's okay to invite in a little bit of messiness and mud, and maybe the dishes don't get done. Maybe the school lunches aren't perfect. Maybe they're
Yeah.
leftovers. And you're also teaching your kiddos at the time
Mhm.
that even though a school lunch might be peanut butter and jelly instead of, I don't know, whatever you might concoct that's all perfect, that it is better to enjoy that time of preparation with the kids and enjoy and send them off to school with ease than to send them somewhere with perfect food or perfect dinner and have stress and
Conflict,
anxiety and
possibly. Right.
conflict. Thank you for that. So I appreciate that piece about the should. I also really love that you brought up expectations because that's part of the whole mix. It's
Mhm.
such a wonderful way to look at this when if she's able to find time to sit down and say, what are my expectations here? Can I give I love how you said, can I give myself grace?
Mhm.
Is there a support group, a cancer support group
Mhm.
available for spouses
Mhm.
of the person who has cancer? There are often sort of phone tree systems within support groups where somebody is able to run the kids to school or step in for you. Or maybe if she's a full-time mom as well as a full-time employee outside the home, maybe there's a leave of absence, but maybe finances don't allow for that. But reaching out, I really am a firm believer, as much as we like to be independent and do it
Mhm.
all, there is a time, and this sounds like one of them, where possibly relatives aren't around, but there's a time to reach out and say, this is quite a lot for me.
Yeah.
Is there support available? And I don't think that makes her any less of a wonderful human being. I think it actually makes her a more full human being because then she'd be able to be present for those in her life and let other people who want to step in allow them that honor of stepping in to be of support. What do you think?
Well, I think there is that vulnerability piece that people really struggle with, and vulnerability is really the heart of connection, deep, meaningful connection. So the more we allow ourselves to be vulnerable and asking for help, the richer our connections and relationships can be. I also was thinking as you were talking about the importance of checking in as well on what do I think it means to be a good parent? What is that? Because I think we all get caught up in the images that we see of good
Hmm.
parenting. There is no such thing as perfect parenting. That needs to be dismissed out of hand. But to me, it's children who feel safe and loved.
Absolutely. I can say 100% across my practice, I have not yet run into an adult who said, "I wish my parents had bought me a nicer car," or "I wish my parents had bought me more five-star meals or one-star meals," whatever it is. Overarchingly, it's, "I
Mhm.
wish my parent had slowed down to see who I
Mhm.
was.
Yes.
I wish my parents had been kinder or gentler or more present." That's what kids want. That's what kids need. That's
Yes.
what we all want and need, quite frankly. And sometimes we mask it with buy me more, give me more, when really underneath is that true desire for most people to connect. So thank you for pointing that out. And that almost fits with the expectations piece. Like,
Yes.
look at what kind of parent you want to be, and
Mhm.
then move into that with baby
Mhm.
steps. Slow down. Might mean
Mhm.
that you don't bake cookies, but it might mean that you sit down and read with your kids for
Yes.
20 minutes. And that's what they'll likely remember more than the perfect dinner or the extra soccer game or whatever it might be. So thank you for bringing that up. I have another question for you. When we look at the autonomy part of parenting
Mhm.
and how when you're the way you framed it, again, we're saying it's not about independence. It's about this sense of I am capable.
Yes.
I am capable. And I'm going to weave this into the preteens because those
Mhm.
kiddos are clearly on her radar.
Mhm.
And you were saying, look at their strengths.
Mhm.
And you come from a very strength based approach. So let's imagine she's seeing these two preteens. Maybe one's 9, maybe one's 11. I don't know the ages. And she sees that the 9-year-old is really good at school and that the other one is really good at sports. And how might this parent lean into those strengths when she's already really taxed?
Well, I think actually I would pull back a little bit and not just school and sports, but
Okay.
as overall functioning in the family,
Okay.
what are their strengths?
Okay.
And are you expecting from them things they can do? And I've heard this over and over because when we're stressed, we go into over functioning mode and we do because it's faster, it's easier. But what's happening is then our children aren't getting the opportunity to actually build their self sufficiency skills. That builds their confidence and then competence. So it's all connected. So, especially in a time of high stress where this family is going through a really big life stressor, look at how they might want to be more helpful in the family's day to day. Maybe one kid loves to be in the kitchen. Now, I'm not saying they're going to want to cook dinner every night, but maybe there's a way they can prep a meal for on a Sunday for a night that week. Or maybe one of the kids really enjoys organizing things. They can be helpful in the family space. So I think it's also kind of flexing what we're used to thinking about in terms of what our kids can do. And yes, I hear from parents sometimes at the beginning, the kids push back a little bit, but because they're not used to it, they're not used to doing more. But then I also hear how they really bloom into it. And you just see them gain confidence because what's happening is, and you mentioned this at the beginning, they're feeling like you trust me to do this. And that feels really good. So I think that is something very kind of pragmatic for this family, actually. Like, how can we all pitch in more? and be more helpful. And let me tell you, I've worked with children with very sick parents. They want to feel like they're doing something to help.
Absolutely. And I agree with you and love the strength-based approach because it works generally across all of our relationships. And I think, let's imagine again, the younger one is good at school and loves to read. Well, you take that and you say, "Hey, hon, do you want to go? Dad's, recovering from his chemo treatment. Do you want to go and read to dad, a story about whatever's going on, maybe the book that you were assigned in school or one of your favorite ones." And the one who might love sports, "Hey, do you want to go outside?" And because they love the body, they love to, "Do you want to go outside and rake the leaves or
Mhm,
play soccer with your younger sister in the
mhm,
yard?" Again, finding ways in a different realm as well, like you're saying,
mhm,
look at the strengths and pull those strengths in, whatever they are. Maybe they're the more compassionate child. Maybe they love cleaning naturally or baking, but really embracing whatever's naturally coming up, move into it and be creative with it. And I think that's a lovely element of parenting.
mhm,
Sometimes we're so set on this child should do this, this, that we forget we can be creative. We
mhm,
can make helping really fun and
mhm,
connective. We can
mhm,
make creating lunches for school the next day. It can be a chore and burdensome, or it can be fun.
mhm.
We can say, "Hey, can you help mom here with this? Can you cut the carrots? Can you, mix the hummus, whatever it might be?" And I love this idea that you're bringing it up because it does build the competency
Yep,
while it's also reducing the mom's stress
exactly.
and helping the family come together because now we're seeing maybe they're in the kitchen, maybe they're in the living room, but it's creating that attunement
Mhm.
and that flow that will help the entire family feel less stressed and anxious. And sure, the school lunches might not look perfect, and maybe a salad cut up by kiddos might not be quite as pretty, but
Yeah, we gotta
it's
let go of that stuff. Let it go.
absolutely, and that again takes us back to the idea of let it be imperfect.
Yeah.
And you also brought up the point about there's no such thing as a perfect parent. And I would imagine that this mom and this diagnosis, and there's so many things I see where whether it's a parent who's addicted to a substance or there's a medical diagnosis or there's an older family member who's gotten very sick, a parent or something, a grandparent, where it throws things off so much. And if we allow ourselves to truly embrace the truth that there is no such thing as being perfect, there is no such thing as being a perfect parent. And Donald Winnicott back in the 50s coined that term about the good enough parent. And I think, and what is the good enough parent? It's the parent who is attuned
Mhm.
85, 90, sometimes 95% of the time. And if you're able to tune into your kids that much, somewhere in that realm, you are going to be a good enough parent.
Right.
Because even kids don't expect you to be tuned in. They might want you to be tuned into them 100% of the time. But think about it. Those other percentage of the time, they're looking somewhere else anyway.
Right, especially as they get older, right?
Yes.
Well, and I would add to that, that I think we also enrich our relationships and decrease our stress when we allow ourselves to show our humanness to our kids. And if we can release those ideas of we need to be perfect for our kids, never get upset, never show distress, that's just not human. And so I think letting some of that go, because I hear that a lot from parents. Letting some of that go is very freeing. It's less stressful because you're not holding in as much, trying to guard against how you're really feeling. And you're opening yourself up to be more connected to your kids. It's okay to say to your kids, this was a really hard day. I am kind of worn out. I might be a little impatient tonight. Like, this is how I'm feeling, and it's okay. Because then our kids learn that they can tell us that too when they're feeling that way.
Absolutely. And I love how you just naturally Modeled iMessages. And so much of the research shows that when a parent or an adult is using an I feeling based message, that not only does it help them be more present, but they're also and honor their emotional state, which improves their mental health overall. But it can also be exactly what the child needs so
Mhm.
that the child realizes, oh, I don't always have to feel good or happy or be
Right.
perfect. So the
Yep.
parent, so listeners, when I'm saying I messages and a feeling based message, I'm simply talking about what Dr. Emily did naturally, which was to say, I feel. So you say, I feel a bit sad right now. I feel really anxious right now. I feel exhausted. Mom's going to go and take a little time out in, the bathroom for 10 minutes, or I'm going to go cuddle up in my chair because I feel really frustrated, whatever it might be. And all of our feelings, even if the mom feels angry, I feel angry right now. All of those feelings are good feelings. They're messengers
Mhm.
about what's going on inside. And when we use those I feel, we're less likely to act out in a way that would be negative. So
And
throwing
we
a
would regret,
we
right?
would
Then there's
regret.
then the regret and the shame that follow that, right?
Absolutely. So if you express your anger in a healthy way,
Mhm.
like I feel angry, I'm going to go and take a walk around the block, I'll be right
Mhm.
back, is far, far superior to throwing a cup or,
Yeah.
punching the wall or something like that. So we model for those in our lives, and thus we're decreasing the anxiety, we're decreasing the stress. And as you said, we're naturally getting this goes back to a piece that's a core of your work is being more relaxed because
Mhm.
we're making a space for all
Yep.
of these emotions that are part of life, and particularly in this situation when there are
Mhm.
health challenges and schedule challenges, it's okay and it's normal and healthy for emotions to be expressed and channeled in a healthy direction.
Yes, and in addition to the emotional piece, which is, I mean, it's absolutely central. Obviously, we're both on the same page with this, psychologists. But I think there's also, to get back to some of the autonomy supportive tools, there's the idea of inviting your child in to collaborate on this seems to not be working well in our family right now. What are your ideas for how things could be better? Or we're really yelling at each other every morning, trying to get out the door. It's not feeling good to any of us. Do you have ideas about what could go differently? I was shocked this morning. My 9-year-old, or he's 10, just turned 10, but he very forgetful child, just always forgets things. And he has a school iPad that he needs to keep charged. And sometimes I remember to remind him, but not all the time because it is his responsibility, right? So this morning he said to me, I mean, school just started. He said, I need to come up with a way that I am reminded every day to charge this iPad. And it's the first time that he took the onus on of like, there needs to be a system here because just me remembering isn't working. And so you see the growth of your child. It doesn't happen probably the first day you try, to encourage more independence or really help them critically think or problem solve, but it really does pay off over time. And can be so surprising what our kids come up with. They're very good problem solvers if we let them.
I am just clapping my hands over here that you brought up the word collaborate because across all relationships, from those with our children to our romantic partners to our friends, especially, I think it comes up with children and romantic partners, we forget the power of collaborating. And we think that kiddos, because
Mhm,
many of us are used to a more authoritarian style of parenting
mhm.
where we are telling the child what to do, we forget how much kids like to collaborate and they like choice. And that when we give them a choice of what would you, instead of telling them, but inviting them to collaborate with us, they often come up with ideas that might be quite a bit superior to what we would come up with.
Yes, they do. I can speak to that. And it takes, again, to speak to our stress. it takes pressure off of us to not have to fix everything and come up with all of the ideas. We have enough in our brains that we are constantly scrambling. And to look to our kids and say, "What do you think?" or "What are your ideas?" They get to think instead of us. It's just they can use that energy, and they have more energy than we do. So,
They do, they have so much energy, those little ones, and you made me think of one of my favorite words in working with couples and families is invitation. When we remember instead of telling, but,
mhm,
telling you should do this or why aren't you doing that? When we learn to invite questions, to invite somebody else's opinion, to invite somebody else's capacities, we make so much more space, not only within ourselves, but within the environment. And often kids are waiting to be invited.
mhm,
They don't even know they want to help, but when they're
yeah,
invited and say, "Oh, do you want to do this?" They're like, "Oh, yes, of course." And they grow into it. So I think it's so important that you bring up the piece again of collaboration, which also, makes space for the invitation part, because it is part of that imperfect sort of wabi-sabi way of learning to make a family system, especially one that's in stress.
mhm,
We get to create something new and fresh, and it won't look like it did before all of this occurred.
right,
It won't look like, and that's where we get to change our expectations.
right,
Because this dear mom may have had all of these expectations consciously or unconsciously in her mind of how things were going to play out.
mhm, yeah,
And we
we
all
all
do
do,
that. We
we
all do
all
that.
do,
We have the house with the white picket fence, and then
yeah,
this stage, and then the rocking chairs with the retirement home or whatever it might look like, right? And all of a sudden, her hopes, dreams for the future are shifted. So there's going to
mhm,
be some grief involved, some reformatting involved, some visions, hopes, dreams that may need to be adjusted. And that's all okay. She
mhm,
just needs the space and the
mhm,
support to whether she gets individual therapy, goes to group therapy, some sort of group support, has the courage to ask. I'm sort of winding down on some of your key topics here. The courage, because it does take sometimes courage, especially for those of us who have been or are perfectionists or recovering perfectionists,
mhm,
asking other people for support we can feel
mhm,
makes us less than.
yeah,
And it doesn't make us less than. It
mm-mm,
makes us humans. As as you said earlier, we on an evolutionary level, we need support.
yeah,
It's just how humans, it's how animals are. All animals, they need other beings to support them. We are all interrelated. So
mhm,
realizing that when you have the courage to say, "I'd love some help here. It would
yeah,
feel really good. I need some help." And there are often in communities, through the hospital, through the
yeah,
oncology center, whatever you're going through your OBGYN, ask for resources,
mhm,
ask for names, phone numbers, and most or a lot of medical offices have them available. They don't often, really have
volunteer them,
volunteer them, but
yeah,
they generally have them if you know to ask.
mhm.
What do you think about that?
I think it's essential, and what was going through my mind as you were talking was imagining this mother and asking her, "If your daughter were going through this at your age, what would you want for her?" And I am sure she would want her daughter to have support no matter how she found that support.
Absolutely. And when we ask for support, again, we are being role models
Mhm. Yep.
that show our children, our neighbors,
Mhm.
you know, anyone who may be in that realm that support is a good thing. Support is a beautiful thing. And in a world where so many people do not have family close by,
Yep.
all we are doing when we reach out for more support is creating a different kind of interconnectedness than
Yes.
what our ancestors naturally had, a block
Yeah.
away.
Right.
So it's not that you're broken, it's not that you're not enough, it's not that you're not strong, it's that you're a human being and we
Right.
are meant to have supportive communities, how we function at our best.
Right.
Oh, Dr. Emily, you are just such a tremendous guest with so much to offer. Do you have any final thoughts for our listeners today?
Well, I think whoever's listening, whether or not they're going through a current crisis or not, I think probably everyone who turned on this episode could benefit from the idea of giving yourselves grace. That we have a parenting culture right now that's very intense and can feel relentless and like we're never measuring up. And I am here to question all of that and speak up against it and remind everyone that if you love your children and keep them safe, you're doing an amazing job.
Okay, on that brilliant comment, I would like to end, but I'm not going to, because you said something that since we're both psychologists, we get it, but it might seem a bit difficult for someone who's in the trenches, really stressed, really sad, really frustrated,
Mhm,
really angry, to say, yeah, easy for you to say, give
mhm.
myself grace. What do you mean by that? How can I possibly, when I can't even pay the rent, how can I possibly give myself grace? What would you say, Dr. Emily?
So, when I talk about giving yourself grace, it's paying attention to that inner critic and talking to yourself as you would talk to your closest friend and people you love the most in your life, and being as kind to yourself as you are to the people you love around you.
So, what you're saying is watch that inner voice.
Mhm,
Watch that inner voice is being kind
mhm.
and gentle and loving
Yes.
and understanding and most of all supportive.
Yes.
Because if you're not being supportive to yourself, showing yourself that grace of love and tenderness and attunement, which also might lead to a bit of yummy self care, which could be as simple as a 5-minute walk or a bath, that by giving yourself that grace, then you will then reduce your stress, reduce your anxiety. You'll feel more
Mhm,
relaxed, even if for only a half hour, and
mhm.
then you'll be able to be more present to
Yes.
those in your world
And more connected.
and more connected. We like
Mhm.
that word,
Yeah.
connected. That's what it's all about, isn't it? Being
Yes.
connected. Yeah, feels good. Well, thank you for connecting with us today. I am truly grateful, and I so appreciate you, Emily, and all the work you do. Where can our listeners find you?
I have a website, emilyedlynphd.com. I'm also at Dr. Emily Edlynn on Instagram, Facebook, and LinkedIn. And I have a Substack called Parent Smarter, Not Harder.
Beautiful. I like that. Parent Smarter, Not Harder. And you are the author of the amazing book, Autonomy Supportive Parenting. And that's everywhere.
Yep.
Wonderful
On
books can be
Amazon.
found.
Yes. Right.
Amazon, okay. And listeners, the spelling on Dr. Emily's last name is Edlynn, Edlynn, two N's in that, but you can find her easily. All the information will also be in our show notes. So thank you, Dr. Emily, for joining us today. It's such a joy and a pleasure.
Thank you, Carla.
And thank you, listeners. This is Imperfect Love.
Thanks so much for sharing your time with me today. Remember, you have the power to transform your life and love fearlessly, if imperfectly, and it's my privilege to help you along the way. You can find more life-changing content, including my books and other podcast episodes, at drcarlamanly.com. Feel free to submit your own confidential questions through my website. I'll do my very best to include your issue on a future episode. If you found this podcast helpful, please subscribe and leave a review. Until we connect again, this is Dr. Carla Manly wishing you oceans of blessings and love. Please note, this podcast is psychoeducational in nature and is not intended to replace formal mental health support. Please contact your healthcare provider or emergency hotline if you need psychiatric care. And as always, please take good care of your amazing, wonderful self.